Hello and welcome to your COVID-19 update for today, Wednesday, September 14, 2022.
Among elderly persons, and for arguments, we can use persons 60 years and older as being elderly. We have for first dose vaccination about 85.3% of those persons 60 years and over would have received the first dose vaccine. Second dose vaccine, we have 76.4% of that age group would have received a second dose vaccine. In terms of boosters, the first booster, we would have seen that 28.5% of persons 60 years and older would have received the first booster. And there are a very small group that came back for a second booster, and this would be approximately 1.5%. So in terms of vaccination, one of the things that we have to really work on is to make sure that more people, more older people, come back to get the booster doses. Because as we know, someone who would have received a booster dose or a second dose 6 months ago is now eligible for that booster dose. And if you don't get that booster dose, then your immune system would not be working as optimally as it should to fight off the COVID-19. We have ongoing training programs for our doctors. We have been doing a number of continuing medical education. So over the last couple of weeks, we have had several sessions like those. We have also been training our nurses so that they can be better equipped with knowledge, and to make sure that we have proper surveillance in place. We've also been training our staff to do surveillance in terms of how to report cases, how a case is defined, and so forth. In addition to all of that, we have also worked with our laboratory staff to make sure that they can take off samples properly, store them, send them down to the National Public Health Reference Lab, where we'll be able to do some of this testing. And that type of training was done especially for monkeypox. In terms of COVID-19, a lot of our staff are already trained to use the rapid tests, to use the gene export machines, and of course to do PCRs. The second patient has also been discharged, and so and we have checked in with the person's close contacts, and again, there have been no signs or symptoms of any rash developing, so they are also cleared. Not at this point, because we are quite satisfied that they cannot spread anything. They have been in isolation with us for the requisite period, so we are quite satisfied. At this point in time, they would not be able to spread anything.
You have been watching the daily COVID-19 update for today, Wednesday, September 14, 2022. I'm Natasha Smith-Thomas. Goodbye.